COVID-19 outcomes amongst patients with pre-existing cardiovascular disease and hypertension. The global prevalence of cardiovascular disease and hypertension have risen steadily over the last 3 decades. Prevalence of cardiovascular diseases nearly doubled from 271 million in 1990 to 523 million in 2019. Coronavirus disease 2019 has multiorgan involvement and severity is associated with presence of pre-existing diseases like cardiovascular disease and hypertension. Therefore, it is important to evaluate the effect of cardiovascular diseases and hypertension on outcomes of COVID-19 patients. The objective of this meta-analysis and meta-regression is to evaluate outcomes of COVID-19 amongst patients with cardiovascular disease and hypertension. English full-text observational studies having data on epidemiological characteristics of patients with COVID-19 were identified following Moose protocol. Studies having pre-existing cardiovascular disease and hypertension data that described outcomes including mortality and invasive mechanical ventilation utilization were selected. Using random effects models, risk of composite poor outcomes and isolated mortality and invasive mechanical ventilation utilization were evaluated. Pooled prevalence of cardiovascular disease and hypertension, correlation coefficient and odds ratio were estimated. The forest plots and correlation plots were created using random effects models. (27,950) patients from 29 studies met the criteria and were included in meta-analysis. In meta-analysis, cardiovascular disease was associated with 3.4 times and hypertension was associated with 2 times higher risk of composite poor outcome. In age-adjusted meta-regression, pre-existing cardiovascular disease was having significantly higher correlation of invasive mechanical ventilation utilization without having any association with mortality among COVID-19 hospitalizations. Hypertension was neither correlated with higher invasive mechanical ventilation utilization nor correlated with higher mortality. Although we identified pre-existing cardiovascular disease as a risk factor for higher utilization of invasive mechanical ventilation, pre-existing cardiovascular disease and hypertension had no independent role in increasing mortality. For more details, below is the link for this interesting study, please review it. Follow us for more videos related to research interpretation.